This lesson goes over the history of the U.S. healthcare system. First of all, there are four major sectors of the U.S. health system, and the history of these four different sectors really influence how the U.S. health system was developed. The first is the practice of medicine. How the history of the practice of medicine in the United States greatly influenced the type of healthcare system that the U.S. ended up with. The second is the history of the hospital system. The third is the history of the public health system. And the fourth is the history of health insurance. I'm going to present the highlights of each of these different systems and try to blend them in together. I'm also going to make reference to what's going on in social policy during the time period to better contextualize it. So common issues that will come up as we go through the history of U.S. healthcare are the costs of healthcare. You will see that the costs of healthcare throughout the later part of American history, the costs rise faster than the rest of the economy, and that presents a lot of problems for the development of the healthcare system, because when the costs are higher than predicted, advocates and the legislature are unable to expand the system because they have to figure out how to cover the costs of the system that they already have. The second issue that the U.S. healthcare system has often faced historically, and it continues to face, is the lack of access to healthcare, where there are significant percentages of the population in the U.S. that don't have access to healthcare, and healthcare is reserved for those that can pay or those that have adequate health insurance. The third issue that is often raised in healthcare politics is quality. And what we find is that throughout American history, the quality of healthcare that individuals receive vary greatly among different groups. So for those that have for wealthy individuals who are able to travel to the top medical facilities in the United States are able to receive the best healthcare in the world. But a very small percentage of the U.S. population is able to access that high quality care. So we're now going to take a trip back in time in an effort to give you some context as to why we still have problems with cost, access, and quality in the American healthcare system. And we are going to start way back in the 1700s. And that's because, as you may have remember I mentioned before, policies in the U.S. are path dependent, meaning that historical influence over political decisions influence the development of public policy hundreds of years later. So let's try to figure out why that is here. All right, so in the 1700s, most persons that were sick were treated at home, and doctors traveled from home to home to treat people in their home. Right there, it wasn't a very efficient system, okay, because oftentimes they would have to send somebody to go to the doctor's house to get the doctor who would come, and then imagine if there is a second emergency, and that person would just have to wait at the doctor's house until the doctor gets back. The doctor had travel time back and forth, and so it wasn't a very efficient system. But also medical care at this time was not very sophisticated at all. Uh, there were very um, few medical procedures that were very successful. And so medical care was really in its infancy. It wasn't until 1765 that the first medical school was created. And even when it was first created, there were still many doctors that did not go to medical school. There were some doctors that were just apprentices and learned by doing, and others that went to medical school. The quality of the medical schools varied greatly. Some were great, some were horrible. In the mid, around the same time, in the mid 1700s, the first hospital was founded. Um, Hospitals in the U.S. began as charity hospitals. They were nonprofits that were funded by charities. And they largely, initially when they were first created, largely housed populations that couldn't pay. At the same time, public health departments began to spring up in urban areas because there was industrialization and disease spread. So let's talk about industrialization a little bit. So before industrialization in the United States, most people lived in rural communities. They did not all live together in tenements or in apartment buildings. But as the United States became industrialized and there were more and more factories, people began leaving their nuclear families, and they'd leave their families and they'd move to cities in order to get work. And they would live in cramped conditions. And as you can imagine, with lots of people in cramped conditions, you get disease spread. And so that is why there became a need for public health departments in these industrialized areas. The healthcare system in the United States remained in its infancy even in the early 1800s. Um, Although the first hospitals were created in the 1700s, there really were only two, um, and then a third sprang. The first two were in New York, and then in Philadelphia, or in Philadelphia, then in New York. Um, and then in the 1820s, another hospital popped up in Boston. But again, these were hospitals that primarily focused on charity care, um, providing care for the elderly and people who could not pay for it. Uh, the growth of hospitals really wouldn't happen until the 1900s. But in addition, so where did people go aside from hospitals? Well, there were poorhouses or almshouses, and these were houses where people who were poor but could not afford, did not have access to a hospital, they went there. Then there were pest houses, which is where they quarantined individuals that were sick. There were We said that medical schools started in the 1700s, but there were still only four medical schools in 1820, and physician training was still very poor. In the 1840s, we saw the development of the first group health insurance policy. It was called sickness insurance. And you'll see sickness insurance refer to quote unquote health insurance in much of the world. We're one of the few countries that call it health insurance because really what it is insuring you against is becoming sick. So anyway, 1847, the first sickness insurance, it was a group policy. We'll talk about what that means at a later time. It's called the Massachusetts Health Insurance Policy of Boston. 1847, there was the American Medical Association was established, and the American Medical Association was a professional or is a professional organization for physicians. And it has been a very influential lobbying group on healthcare policy in the United States. And so they were founded in 1847, but they really didn't become powerful until the 1900s when they began to organize into state medical societies, and these state medical societies then issued licenses to for physicians to practice in the states. Their focus was really on ensuring the well-being of doctors and trying to find a way to standardize medical education and medical care. Also in the 1840s, anesthesia was developed. The development of anesthesia was very important because it drastically affected the development of the healthcare system in the United States. Surgeries could now be conducted in a way that was not excruciating. The person didn't have to be awake for the surgery. Uh, Bacteria was also discovered, and so with the discovery of bacteria, there was the beginning of a push to conduct surgeries and the like in a hospital setting because the hospital setting could be more controlled. The spread of bacteria theoretically could be decreased. So, with the development of anesthesia and the identification of bacteria as a threat to health, hospital systems began to develop. Now, these hospital systems that developed in the 1850s were physician-owned hospitals. So the physicians owned them and they worked in them. They were largely seen as still being unskilled providers, but with the discovery again of bacteria and anesthesia, there began to be growing demand for physicians. Physicians in a hospital setting. Physicians also realized that it is a lot more, quote, efficient for the physician if the patient comes to the physician for care. And so through the creation of a hospital, patients could come to the physician uh, for treatment. The physician didn't have to ride around to different houses to provide treatment. As physicians began working together in these larger practices and organizing, they began to consolidate their power and to become more powerful. So while hospitals allowed physicians to deliver medical practice in a way that was more cost effective for them, it became more costly for the patient. So before the widespread use of hospitals to deliver care, patients, the cost of medical care was cheaper. It was just the provider's rate. And the payment could even be a barter, right? So the doctor comes to see you, you give him the coins that you have, a chicken, and some eggs to go with it, right? With the professionalization of, um, of the practice of medicine and the development of the hospitals, the expenses on the patient began to increase because now the patient didn't just have to pay the provider's rate, they also had to pay the cost of the hospitals. And those fees were expensive. And so, or more expensive at least than just seeing the physician, right? So, hospital insurance developed in 1853. Hospital insurance is health insurance that only pays for visits to the hospital, and sometimes it was even only to specific hospitals. Nowadays, we call this type of health insurance plan a catastrophic plan, and the catastrophic plan only pays for for healthcare costs that are large costs or catastrophic costs like hospitalization. The demand for healthcare, for medical care in particular, increased again in 1910 for a few reasons. The first is that there were actually drugs that were developed in 1910 that could be used to treat diseases and illnesses. And these drugs were actually effective. So it's not like that we didn't have drugs before that, but they were not very effective at curing diseases or illnesses. The early 1900s were a turning point in American healthcare because the benefits of healthcare became more tangible with the development of antiseptic techniques that greatly decreased the morbidity or the number of people who died from surgeries. And anesthesia became more and more widespread and more advanced. So, as the public began to see the benefit of medical care, the American Association for Labor Legislation drafted the first model national health insurance bill. So, in the United States, we have been trying to achieve universal health care through national health insurance since 1915. Okay. Since 1915, there have been attempts to acquire a national health insurance program that is universal. Well, this proposal didn't go anywhere because, as I said before, the American Medical Association had begun to become powerful in the 1900s. And their leadership in particular, and many of their members were very much against any form of national or government control over the practice of medicine and in setting payments or rates for medicine. As we continue through the early 1900s, we find that most states have state health departments now. And again, the cost of medical care continues to increase because the quality of healthcare was better. And that created the perfect mix of factors for health insurance, private health insurance, to proliferate. So we did say that the first health insurance policy was in the 1800s, but it wasn't until the early 1900s that we begin to see what is more similar to modern health insurance. Also, another impactful event that occurred during this period was the Flexner Report. Then we're going to pause here and learn a little bit more about the development of health insurance and about the Flexner Report and its effect on the delivery of healthcare.